everyone, my name is Audra and today I'm going to be talking a little bit about universal health care. So my question is, should universal health care be free to everyone? Did you know that 28.9 million people in the U.S. as of 2017 did not have health insurance, that they were uninsured? So with that, most people who are uninsured don't go to the doctor because they can't afford it. So you might be wondering a little bit about what universal health care is, and universal health care by definition is all people have access to the health care and services they need, when and where they need them, and that's without any kind of financial hardship. So with universal health care, no one is going to be left out, medication is going to be more affordable, and it could better our healthcare system altogether. So some people don't have that insurance, and because of that, they are neglected in the healthcare system. With that, most people who don't have insurance do go without. Since healthcare is so expensive, a lot of people can't really afford the outrageous bills that are in our healthcare system. According to Taylor Mackey, she is a publisher at Palmer Chiropractic College, and she stated that 33.1 million people, which is 10.4% of the U.S. population, don't get the care that they need, and they don't have health insurance. So since people do go without that health care, insurance, most go without the medication they need to survive. Robert Wagner, a publisher at Bloomberg.com, which is known for its finance media, says the average cost of medication per person per year is $1,200, and the average cost of cancer drugs are $10,000 a month. With universal health care, these costs could possibly come down, and the people who need these drugs to live will be able to afford them. The World Health Organization, which is they go by WHO, is a specialized agency of the United States that provides technical assistance to countries and sets international health standards and all these health guidelines. They give information saying that protecting people from financial consequences of paying these medical bills out of their own pockets reduces the risk of being put in poverty. And with protecting these people, that's what the UHC, Universal Healthcare, wants to do. So now that we've talked a little bit about uninsured things, we're going to talk a little bit about how UHC is going to be able to help our healthcare system. So Universal Healthcare overall wants to ensure that people in the United States have affordable health care coverage that provides essential health benefits, and this will allow us to move toward a healthier and more productive society. Healthcare will no longer be about money, but more of the patient care. So the AAFP, which is the American Academy of Family Physicians Foundation, advances in the values of family medicine through humanitarian, educational, and scientific philanthropy, and is dedicated to better health for everyone everywhere. And they give a little information saying that the best approach to getting to the universal healthcare system in the United States is the pluralistic health care approach. This means that we'll need multiple for-profit, non-profit, private organizations, and the government's help to make this possible. Such an approach will include a guarantee that all individuals have access to affordable health care coverage, and that they will have a physician through birth to death, and that they'll have affordable health care across the whole board, and that all medical services will be covered, meaning if you won't have to pay as much to have a baby in a hospital. You won't have to pay for EMS bills as much as you would now. So, with that being said, universal health care coverage is better for the United States overall because it will focus on the care that we need instead of how we're going to pay for the care that we need. And it's going to give us the care that we need and also the medications that we need to be able to survive. And I think that's the best option overall. So thank you guys for listening, and I appreciate you for your time. Thank you.